Good afternoon. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today is Monday, June 23rd, 2025. The time is 3:32 p.m. We are in room 500 of the John A. Wilson Building and also live on the Zoom internet platform. This meeting is being broadcast live on cable channel 13, as well as on my YouTube page at CMC Henderson. I'm calling to order this meeting to consider and vote on the report and recommendations of the Committee on Health for fiscal year 2026 budget for the agencies under its purview. I would first like to acknowledge the presence of a quorum between myself, Councilmember Brianne Nadeau from Ward 1, Councilmember Charles Allen from Ward 6, and Councilmember Zachary Parker from Ward 5. I will first just provide an overview of the committee recommendations before opening up the floor for discussion. The committee's budget report was developed after several months of hearings, testimony, meetings, and other forms of engagement. The report provides recommendations for agencies under the committee's purview, including the Department of Healthcare Finance, the DC Health Benefit Exchange Authority, DC Health, the Department of Behavioral Health, the Office of the Deputy Mayor for Health and Human Services, and the Not-for-Profit Hospital Corporation, also known as United Medical Center. The committee held 6 public hearings on the mayor's proposed FY26 budget, and I want to thank each resident, advocate, and government official who testified before the committee. Many of your voices are reflected in the budget report, which is a good report, and you should read. This fiscal year, the committee knew that health agencies would experience significant cuts that we would face with tough choices in this tight fiscal environment. Our top priorities were 1, ensuring as many district residents as possible were able to maintain high quality health care coverage. 2, that the key public health interventions to prevent and treat disease, which are being slashed at the federal level, were protected here in the district. Despite economic constraints, we remain deeply committed to supporting our most vulnerable among us. For FY26, the committee's recommendations for strategic investments focus on several themes: enhancing support for behavioral health and substance use treatment, increasing healthy food access, improving health for birthing parents and families, enhancing patient care and outcomes, strengthening the healthcare workforce, promoting student health and achievement, and improving access to critical healthcare infrastructure. I'm now going to summarize the changes we're proposing in each agency under the committee's purview, as well as transfers to and from each of the committees, or to and from other committees. And I encourage the public to review our full committee report for more background and a detailed narrative. So first, the Department of Healthcare Finance. The most drastic health-related cuts in the mayor's FY26 proposed budget were to the district's Medicaid and Healthcare Alliance programs due to significant cost increase resulting in spending pressures in these programs. These spending cuts were paired with major policy shifts, including transitioning approximately 25,500 individuals off of Medicaid to a basic health program administered by the Health Benefit Exchange, as well as significant eligibility limitations to the Alliance program. I'm going to briefly describe some of the implications. For Medicaid, the mayor's proposed budget reduces the Medicaid eligibility for childless adults and parents and caretakers from 221% of the federal poverty line to 135% of the federal poverty line, again, impacting approximately 25,500 adults. Under the mayor's proposal, these individuals will transition to a new basic health plan, which will be administered by the Health Benefit Exchange. The district has some of the most generous Medicaid eligibility standards in the country, but our spending on Medicaid has quickly outpaced the city's revenue projections, creating significant pressures in FY26 and throughout the rest of the financial plan. The Basic Health Program is a tool created by the Affordable Care Act that is used by several other states to increase healthcare coverage affordability. BHP enrollees will continue to have healthcare coverage for primary care, specialty care, hospital services, skilled nursing facilities, laboratory services, durable medical equipment, and some mental and behavioral health. The BHP, however, will likely not cover some things that are covered by DC Medicaid, including dental, vision, substance use disorder treatments, and non-emergency medical transportation. The committee was not able to identify funding to cover those loss benefits under BHP, but we urge the committee of the whole to identify this funding, particularly the $5.2 million needed for dental coverage. For the Alliance, the proposed budget also makes a number of changes to the Alliance and the Immigrant Children's Health Program, including moving all of the Immigrant Children's Program enrollees to Alliance, reducing eligibility and benefits for adult enrollees in FY26, and ending adult eligibility beginning in FY27. The mayor's proposal also included policy changes to further restrict eligibility, like requiring face-to-face recertification every 6 months, increasing requirements to show proof of residency, and cutting coverage to benefits like durable medical equipment. The committee was deeply concerned about these reductions, that they would lead to significant health challenges for district residents and our healthcare system overall. Therefore, the committee recommends restoring $3.7 million in FY26 and $12.1 million over the financial plan to strike several of the provisions in the mayor's proposal. Specifically, we remove the face-to-face recertification requirement for adults. We allow public school enrollment to count as proof of residency. We also allocate $1.8 million to increase the moratorium age for new Alliance beneficiaries from 21 to 26 in FY26. We remove the face-to-face certification requirement for youth under 19 throughout the financial plan. We remove the recertification every 6 months requirement for youth throughout the financial plan. We restore coverage for durable medical equipment for all adults through FY27, and we restore coverage of durable medical equipment for youth throughout the financial plan. The committee will continue its oversight over the Alliance program, as there are still a number of outstanding factors, particularly uncertainty on the federal side. These changes and the future financial projections may affect policies and the cost moving forward. The Office of the Healthcare Ombudsman. The committee proposes funds through the Budget Support Act, subtitle Healthcare and Public Benefits Ombudsman Amendment Act of 2025, expanding the scope of the existing Office of Healthcare Ombudsman to include public benefits such as the Supplemental Nutrition Assistance Program and the Temporary Assistance for Needy Families Program by adding 2 additional FTEs within the Department of Healthcare Finance. We work closely with the Committee on Human Services to develop this proposal. Both committees frequently hear from residents about errors, delays, and tech challenges with their public benefits applications. Especially in a time with abundant changes to both healthcare and public benefits, this expanded office will assist residents in navigating a new eligibility and certification requirements. Thank you to Councilmember Freeman and his staff for their strong collaboration and partnership on this topic. In terms of maternal health, the committee expands the funding for the home visiting services for first-time parents by approving a $100,000 increase and accepting a transfer of $300,000 from the Committee on Public Works and Operations for a total of $625,000 for the Nurse Family Partnership. Thank you to Councilmember Nadeau. This will help with workforce and improve health for birthing parents and families. The committee also approved $500,000 in recurring funds for the distribution of diapers, formula, and other essential supplies via grant to the DC Diaper Bank, which is an increase from last year, but it is a grant program that we have had for several years in the district. In terms of provider reimbursement rates, even in tight fiscal climate, the committee recognized the need to further invest in our healthcare providers who accept Medicaid by ensuring their reimbursement rates are comparable with those in the region and are sufficient, so providers continue participating in the program. The committee has pushed the Department of Healthcare Finance on this over the past year, particularly for professions like dentists and pharmacists, where rates have not been adjusted for several years. The committee is therefore happy to approve the $7.9 million enhancement for the dental rate increase in the budget, managed care, and for fee-for-service providers, providing a payment parity for dental providers addressing a payment parity issue dental providers have been raising to the committee. The committee moves the mayor's subtitle Direct Care Professional Payment Rate Act Amendment Act of 2025, which freezes the enhanced wages for the direct support professionals at 117.6% of the living wage. The subtitle saves $3.9 million in FY26, and the committee could not identify those resources to restore this funding and strike the subtitle. That said, the committee urges the executive to unfreeze the DSP wage for FY27. Director provider payments. Last year, the committee approved 2 BSA subtitles, the inpatient hospital directed payments and the outpatient hospital directed payments, which taxes each qualified hospital on their inpatient and outpatient net revenue at a universal rate. The tax generates a revenue sufficient to fund the directed payment funds, from which DHCF deducts 12% for district retention to reinvest in Medicaid. Healthcare Finance officially submitted their 2025 preprint to CMS this month and expects approval retroactive to the start of fiscal year 2025. In the middle of the committee's budget oversight process, we learned that the agency is increasing its tax rate for FY26, which the committee largely reinvested into Medicaid to capture additional district retention. Next, the Health Benefit Exchange Authority. In addition to the basic health program, I want to touch on a few other components of HBX. First, healthcare for childcare. In FY26, the budget funds the pay equity fund and maintains the $12 million for the healthcare for childcare program within HBX for 2026. However, the committee is concerned that this funding was shifted to one-time funding and that the rest of the financial plan does not include funding for the pay equity fund or the healthcare for childcare program. Any further reduction to the pay equity fund will not only affect early childhood educators' income, but also their health insurance. In terms of IVF coverage, in 2023, the council unanimously approved DC Law 25-49, the Expanding Access to Fertility Treatments Amendment Act. This law required health insurers to cover diagnosis and treatment for infertility, including IVF and standard fertility preservation services beginning January 1, 2025. The committee worked closely with HBX and the Department of Insurance, Securities, and Banking to determine the cost for HBX to implement this legislation, and we fully funded the law in FY25 budget. This benefit has proven to be extremely popular amongst HBX beneficiaries. Use of these services have, in fact, exceeded estimates for enrollees on both the individual and small business plans, which includes congressional staffers. Given the high utilization, HBX has estimated a one-time $6 million spending pressure in the plan year 2025. It is worth celebrating that so many individuals have been able to take advantage of this new benefit to grow their families. The committee, however, was unable to identify funds to address this spending pressure, but we encourage the executive, including the Department of Healthcare Finance, to work closely with HBX to ensure that there's adequate funding to provide this covered benefit to all district residents in 2025. DC Health. The committee proposes several enhancements to DC Health's budget, restoring some key public health services and investing in evidence-based programs to enhance health and wellness in districts. First, on HIV and AIDS. Through tireless work of the DC Health staff and community organizations, the district has reached a significant milestone this year of under 200 new cases for HIV for the first time since the 1990s. Unfortunately, many of DC Health's most effective initiatives have been scaled back or cut in FY26, including the loss of $2.4 million in federal funds for HIV prevention and surveillance discontinued by the U.S. Centers for Disease Control and Prevention with no rationale. DC Health has already put in stop work orders on these grants, and continued funding losses would force the district to cut critical services like the emergency post-exposure hotline, PrEP housing for individuals at high risk of contracting HIV, the HIV self-testing program, and outreach grants to community organizations like the Women's Collective, who provided powerful testimony at our hearing. Therefore, the committee makes several recommendations to restore and enhance HIV and STI services. $1.3 million to partially restore the HIV prevention and surveillance federal grant loss. Although we were unable to fully restore it, we got partway there, more than halfway. And also $411,000 to the DC Health and Wellness Center to expand their hours to include 1 evening per week and 2 Saturdays per month. This will enable the center to be able to provide testing and treatment for HIV, STIs, and tuberculosis to district residents who currently can't access the center within its Monday through Friday, 8:30 to 4:30 p.m. operating hours. In terms of food access, many district residents cannot consistently afford enough food to feed themselves and their families. According to the Capital Area Food Bank, 37% of district residents are experiencing food insecurity in 2024. The committee makes several recommendations. First, we partially restore the $200,000 for the local food purchase previously funded through the federal local food purchasing cooperative agreement program, which was abruptly canceled in March of 2025. This federal grant supported the nonprofit Dreaming Out Loud in sourcing local produce for the Joyful Food Markets and the Grocery Plus program. Dreaming Out Loud testified that the cancellation of this funding would lead to delays in their opening of the new Marion-Barry Avenue Market in Ward 8 this summer. To avoid any delay in opening this critical food access point and job hub, the committee partially restored this funding. We fully fund Bill 26-109, the Farmers Market Support Amendment Act, with $493,829 going to DC Health and $225,000 going to the Department of Licensing and Consumer Protection through a transfer from the Committee on Public Works and Operations. This will support the opening of the expansion of the farmers markets for low food access areas. We also extend the grocery access pilot program for a second year in DC Health by providing $120,000 to enable 1,000 district residents who participate in the educational programs under the SNAP Ed to purchase groceries online without paying additional fees. In the area of school health, DC Health is in the midst of a significant transition of the school health services program from being transferred as a grant to now being operated in-house by DC Health. The program provides health professional staffing to manage the district's 183 health suites for approximately 90,000 public school children. This transition will enable DC Health to ensure high quality training for school staff, improve the program's IT infrastructure, and foster better coordination among health suites. DC Health testified at the public hearing that although DC Health budget chapter did not reflect these staffing changes, the agency will work with the OCFO to ensure that reprogrammings are completed to ensure a smooth start for school year 25-26. Further, the committee fully funded the Child Behavioral Health Services Dashboard Amendment Act of 2024 through a transfer of $112,000 in recurring funds from the Committee on Youth Affairs. Thank you, Councilmember Parker. This legislation will create an online dashboard to help families, school personnel, and service providers identify and connect with available behavioral health services across the district. Certificate of Need, the committee fully funds the DC Law 26-7, the Certificate of Need Improvement Amendment Act, with $586,000 in FY26, and then we fully fund it across the financial plan. This legislation will encourage more healthcare entities to open in the district by removing the cumbersome and costly requirements of the Certificate of Need program administered by the State Health Planning and Development Agency within DC Health. We also approved the mayor's proposed subtitle on State Health Planning and Development Agency Act. In terms of strengthening the healthcare workforce, we made several investments in this area. So we fully fund the Counseling Compact Approval Act of 2024. This was a bill that was championed by former Ward 7 Council Member Vincent Gray. It authorizes the mayor to enter into the National Counseling Compact, increasing the number of professional counselors available to be licensed here in the district. We propose and fund a budget support act title called the Department of Health Licensure Pathways Program, which will enable DC Health to assist internationally trained health professionals in obtaining their licensure and credentials required to practice here in the district. Thank you to the La Clínica de Pueblo for identifying this as a priority in their community needs assessment. We transfer $150,000 to the Committee of the Whole for a BSA subtitle, the Certified Nurse Aid Workforce Support Amendment Act of 2025, which will go to the Office of the State Superintendent for Education to partner with a local university to train at least 25 district high school students to become certified nurse aides. And finally, we approve the BSA subtitle, the Health Occupation Criminal Background Check, which will streamline background checks for health professional renewals in partnership with the Metropolitan Police Department. In terms of environmental health, I'm almost done with DC Health, I promise, but sorry, we still have DVH to go. Okay, environmental health. We approved the mayor's proposed subtitle to establish the Environmental Health Administration within DC Health by transferring a portion of the existing DOEE Healthy Housing Branch and Dormant Medical Waste Management Program to the DC Health. DC Health will now be responsible for administering the implementation of the Childhood Lead Poisoning Screening and Reporting Act of 2002, including working with pediatricians on the required lead screenings for children under 6. We work closely with the Committee on Transportation and the Environment, to which this subtitle was jointly referred. So thank you, Councilmember Allen and your team for your collaboration. In terms of animal control, we approved the mayor's subtitle. We approved the mayor's funding, $8.3 million to right-size the animal control contract. This contract underwent significant changes in fiscal year 25, including moving to a new contractor for the first time in over 40 years, as well as the development of a new animal shelter in DC Village. The committee report notes that although we have heard some complaints from the new contractor, about the new contractor for the contract, data actually indicates that their performance is significantly improved from the former contractor. Euthanasia rates have dropped from 147 animals in October of 2024 to just 34 in May of 2025. The new contractor's live release rate is 6 to 7% higher, and they have reported no increase in incidents of animal bites for staff or volunteers. One significant challenge is space, as there have continued to be construction delays for the new animal shelter to replace the existing one on New York Avenue. The contractor does not have enough space at the New York Avenue shelter to accommodate stray pets and owner surrenders. Although the committee continues to have concerns about the executive's decision to locate the new shelter in DC Village Avenue Southwest, we do urge the executive to prioritize fully opening this new shelter and closing the shelter on New York Avenue as soon as possible. All right, DBH. The mayor's proposed budget included a $2.3 million cut to the school-based behavioral health program. This reduction, combined with years of oversight and stakeholder feedback, raised serious concerns about the program's stability and long-term success. Despite increased investment, DBH has continued to struggle with managing grants, filling clinician positions, and supporting CBO's integration into school communities. Given these persistent challenges, the committee considered transitioning the school-based behavioral health program out of DBH to DC Health. In response, the DBH director, Dr. Barbara Bazaron, submitted a letter outlining planned improvements, including changes to the funding model, stronger supervision and performance standards, better billing practices, improved use of school level data, and closer collaboration with school nurses. I also heard from several DBH clinicians who expressed concern about the proposed transition and urged the committee to give DBH more time to improve the program. Rather than move the program immediately, we recommend a new subtitle, which requires DBH to submit a detailed improvement plan by October 15th, 2025. The committee will maintain strong oversight and revisit the transition of this proposal if there is insufficient progress. The subtitle also requires DBH to award CBO grants at a rate of at least $120,000 per school to help address retention and service quality. In terms of substance use and behavioral health, the committee recommends $1.7 million in FY26 to continue funding community-based outreach teams that have provided substance use and behavioral health treatment at 6 locations in wards 1, 5, 6, 7, and 8. These teams will work in areas with visible outdoor drug use and provide critical connections and services. Funding includes a $200,000 transfer from the Committee on Transportation and the Environment, thank you, Councilmember Allen, as well as funding allocations from the Opioid Abatement Fund. The committee also accepts $750,000 from the Committee on Public Works and Operations to continue an outreach team operating in Ward 1. Thank you, Councilmember Nadeau. The committee recommends $400,000 enhancement from the Opioid Abatement Fund to restore funding to the OCME's illicit drug surveillance program, which was lost due to the expiration of this federal grant. This enhancement sustains OCME's forensic toxicology testing, which provided critical data on suspected opioid-related fatalities, enabling agencies to devise effective responses to the opioid crisis. Without this funding, achieving a comprehensive understanding of the role of opioids and other toxic substances in district families would be impossible. For the second year, the committee recommends restoring the $907,000 for the Court Urgent Care Clinic at DC Superior Court using funds from the Opioid Abatement Fund. The clinic provides same-day mental health and substance use assessments and immediate referrals to detox, inpatient, and outpatient care to court-involved individuals and courthouse visitors. Oh, okay. We make some changes to the Opioid Advisory Commission. Y'all can read about it. It was 21-member body. It was a lot. Changing that. FD12. Okay. The committee fully funds the Enhancing Mental Health Crisis Support and Hospitalization Amendment Act 2024 by providing $663,000 in FY26 and $1.7 million over the financial plan. This legislation improves the involuntary hospitalization and voluntary commitment program and will support the development of more training modules as well as public awareness. All right. DMHHS. It's the home of Age Friendly DC, which is a program that started in 2012. Age Friendly is supposed to bring together district residents to identify and work together on goals to make the district a more welcoming place for district residents as they age. We express concern that Age Friendly DC has been shifting away from its focus on seniors when the district faces long-term care and affordability crisis for residents who want to age in place. I'll give you an example. The 2024 Age Friendly Livability Survey surveyed 611 district residents on aging in the community. Only 25% of the respondents were over the age of 60. The results were not disaggregated by age, obscuring the unique challenges that seniors related to walkability and access to public transportation. Therefore, we recommend that DMHHS repurpose their vacant Age Friendly DC coordinator into a long-term care strategic coordinator role to better track, coordinate, and enhance the long-term care services provided by all of the agencies under DMHHS purview. DMHHS I will also note in our policy recommendations, the committee did urge DMHHS to take a more proactive strategic role in leading on key systemic issues within the health and human services cluster. This includes better oversight of St. Elizabeth's Hospital, strategies to decrease the district's SNAP error rate, and improvements to the school-based behavioral health program. Deferring to agency leadership when there are clear harms being done to district residents is an abdication of responsibility. And we're respectfully asking for the DMHHS to lean in. United Medical Center, it's closed. It closed on April 15th, 2025. It's still a chapter, but yay, we made it. Cedar Hill Regional Medical Center has opened. Cedar Hill Urgent Care Center. Hear that? There is a urgent care center that doesn't require you to go to the emergency room. That's open too. Both in Ward 8, operated by Universal Health Services. And so I want to thank all of the UMC staff for their years of dedication and service. Finally, the committee prioritized filling critical funding holes within the health agency clusters this year. We had very limited funds to transfer to other committees, but we did transfer $500,000 to the Committee on Human Services to restore the mayor's proposed cut to DC public libraries, which a lot of people use to get information about health. It's also a cooling center, and it's hot outside. All right, so with that, 13 pages deep, I will open up for questions and discussions. Wow, has everybody's time. Oh, okay, Councilmember Nadeau. Yeah, great.
Thank you very much, Madam Chair, to you and your team for all the work you have done on the budget and your partnership on many of our shared priorities. As you mentioned, the proposed budget we received made devastating cuts to many of our critical programs in the district, and you and your team have done a tremendous job reversing some of those cuts, allowing this committee to save healthcare for thousands of families across the district. Even when we're facing a difficult budget, we can find ways to balance that without doing so on the backs of some of our most vulnerable residents. You all did tremendous work pushing back on the cuts to Alliance, and I hope that we can work together in the Committee of the Whole to get those final pieces funded. And I'm also thrilled the committee put resources to address substance use disorder, the Substance Use and Behavioral Health Services Target Outreach Grants, including in the vicinity of 6th and T, and none of those were funded. And you went and got that money. Thank you for accepting the funds for the rest of our programs in Ward 1, serving Columbia Heights, Mount Pleasant, Lower Georgia Avenue, and U Street. We're thrilled that we're going to be moving forward and making that a permanent program rather than a pilot, which is why I went and found the recurring funds for that, as well as more than $1.2 million in recurring funds to ensure that home visiting services in the district remain supported over the next 4 years after the Department of Healthcare Finance refused to implement Medicaid reimbursement for these programs, leaving a lot of money on the table for new moms and hardworking moms who are just trying to have healthy children. It is clear from your committee report that you and your team are doing rigorous oversight on critical programs under your purview, from school-based mental health to school nurses to the welfare of animals and so much more. So I want to thank you for your diligence and your perseverance. Thank you, Madam Chair.
Thank you. Councilmember Parker.
Thank you, Chair Henderson. And I want to say at the outset, congratulations to you and your team on all of the hard work that has went into this budget. Am I going out of turn? No. Oh, okay. Oh, yes. I just appeared. I appeared. I celebrate some important wins in the committee's budget, including fully funding the Child Behavioral Health Services Dashboard, which I was proud to introduce last year with you, Councilmember Henderson. The goal is that this will serve as a one-stop shop for families so that they know what services and resources are available to their child. I'm happy to see the restoration of funds for Alliance beneficiaries, which removes the face-to-face recertification requirements for adults and youth. While there is work to do, and I heard that loud and clear through the budget oversight hearings, to get folk who are no longer in the district off our rolls. I appreciate that this does not pose undue harm to the many residents that would have been harmed should we have maintained that recertification requirement. I absolutely love that the committee has expanded food access by funding or expanding the grocery access pilot program, restoring funding for Dreaming Out Loud. And if you have not seen what the folk at Dreaming Out Loud are doing, I highly encourage you to go check them out. It's truly inspirational, as well as funding the Farmers Market Support Amendment Act of 2025. The committee also partially restores funding for the HIV prevention and surveillance grants. And this is something, when we get to the full council, I'm going to say we need more money to fund this. We have made such tremendous progress as a district in combating HIV and other STIs. So much so that our levels today are lower than they were in the 90s. And that is in large part to the great work of the team at DC Health, but these funds and grants that allow for significant outreach. And then the last thing I would just say, I'm excited to see the committee's approval of transfer of the school health services program and the school-based health centers to DC Health. I did have a question here. I don't know if just if you can, I was under the impression that the school health services program was already operated through DC Health via contracts, but this is so that they can hire the nursing teams themselves. And if that's the case, what implications might that have on staffing, which we know has been a challenge for our school teams?
Okay, just for clarification, you're asking about the school-based health clinics, or you're asking about the
The school health services program.
Okay, so the
which
nurses.
I'm understanding that is being brought in-house to DC Health.
Right.
I thought it was already being operated. It was being operated through DC Health, but now they're going to be employees of DC Health.
Correct. So the way that the school health services program worked before, it was operated as a grant through Children's School Services. That is no longer a grant, and now we are, well, DC Health is in the process of hiring those folks as essentially DC government employees. As you know from the hearing process, and just sort of in general, right? When a school district that is neighboring to us makes a significant change, it impacts everyone, which is what had happened along with our school nurses. Our neighbor to our north, Prince George's County, had a change in their funding, and as a result was poaching a lot of our staff. We were not being able to sort of keep up in that way. Add to that, we had some challenges in terms of training and oversight. And so DC Health felt that as opposed to going a private contractor way, that it would be more efficient for us to be able to hire those individuals as DC government employees and to maintain and operate the program in-house. They have already started that process, but there was a mistake that was done. And so although there was a reprogramming that was done in FY25 for that funding, for FY26, somehow those positions did not make it to the budget book. So that's why I was saying that OCFO and DC Health are going to have to work on a reprogramming, because our office, as well as our budget office, simply did not have the time to create 225 new positions to fix their mistake.
I got it. One quick follow-up.
Sure.
Are we to assume that they will be able to address the funding issues or the pay issues, given that they will now be DC employees?
I think they are. They extended offers to everyone who is currently working, and they haven't yet have anyone turn them down. It is important to remember that, you know, as a DC government employee, it's not just your salary, but also your benefits, which is a little bit different when you're working for a different contractor.
Or working as a contractor?
Working as a contractor, yeah.
Okay. I've taken up too much time, but thank you. I think that is a step in the right direction. I join you to introduce legislation to kind of strengthen this program, and I do think moving it in-house to DC Health is a step in the right direction. So I look forward to seeing how that plays out. But all in all, I think this is a strong report, and it will do a lot of work to move the district's health infrastructure forward. Last thing I would just say, and I would be remiss not to mention, there's the elephant in the room, which is the federal government. And we don't know what we don't know yet. And so while this is a huge step in the right direction, I am hopeful that we aren't forced to take a major step back due to unwanted cuts to Medicaid or other aspects of our local health ecosystem. But thank you.
Thank you, Councilmember Parker. I also just want to mention, because you mentioned the HIV grants, that the Committee on Executive Administration and Labor also contributed with a transfer of $100,000 to help us get to where we are. And I also just want to clarify for people who might be listening, we do have the school-based health centers that operate at our comprehensive high schools in the district. 2 of those locations will continue to be contracted out with our partnership with Unity Health. And then DC Health will actually operate the others in-house as well. Councilmember Allen?
Thank you very much, Councilmember Henderson. Obviously, congratulations and a huge thank you to you and your entire staff. This is a lot of work, and I think especially one of my colleagues talked about the changes you were able to help make with the Alliance. I know that wasn't easy either, and while it doesn't have every protection that we want in, I think it's significant improvement from what came to the council, and I know that was a lot of hard work that made that happen, so thank you. The Alliance has been a absolutely vital program in our city for a very long time, and it's worth fighting for and protecting. Definitely want to, of course, extend my thanks for working with my team and my in Ward 6 when it comes to the Southwest opioid effort. And so thank you for having those funds accepted so that we can continue that support there. And I know that our teams work together on the some recommended changes around the Environmental Health Division proposal at DC Health, so it would work with the Department of Energy and Environment. So I appreciate you doing that. I wanted to just ask one quick question because I've heard from some of my school communities about behavioral health. So I think different than what my colleague was just asking about, but I was trying to track and follow. In the BSA, you've got a subtitle, School-Based Behavioral Health Program Strengthening. And then the thing that I have heard concern from a few different stakeholders in schools is related to the School-Based Behavioral Health Transfer Amendment Act of 2025, which I don't actually believe is in this committee, but I noted you had a BSA subtitle that seemed to be trying to work on strengthening those behavioral health services. I want to ask if you could expand a little bit about your strategy and why you are putting the BSA subtitle here. I believe that the transfer amendment is retained in the committee of the whole. No, where did that go?
We had a transfer amendment that was drafted. We were prepared to transfer the school-based behavioral health program from the Department of Behavioral Health to DC Health. All
right, excellent then. So could you help explain a little more so that I can help understand, since I've gotten some concern around that?
Yeah, so I'm going to try to say this in sort of the nicest way possible. But after 3 years of chairing this committee, my biggest frustration had been with the Department of Behavioral Health, and what I felt was them not hearing the concerns that were being raised from school leaders, the concerns that were being raised from families, the concerns that were being raised from the CBO clinicians who were operating this program about the challenges of this program. If folks will recall, and I think you were on the council at this time, our expansion in school-based behavioral health came out of the South Capitol Street Memorial Amendment Act, a number of years ago. In all, I think we expanded too quickly, too fast, and didn't really put into place a funding model and structure that was actually financially sustainable. As a result, this school year, 42% of our public schools actually had no clinician at all, even though we had money for everyone to have one. When asked with DBH around what are we doing, there were a couple of, I would say, half-hearted pilot programs that were offered to sort of strengthen this program, although not a lot of people took them off on many of those offers. And so I was done and ready to move it. Last week I had lots of conversations. I had a conversation with the Deputy Mayor for Health and Human Services. I talked to the city administrator. I've talked to the mayor about my concerns. And finally, last week, I got a call from the director of the Department of Behavioral Health with a list of promises around essentially the things that we have been talking about for 3 years, and a quite lengthy letter making her commitment to follow through on those things. So because DC Health was going through a transition in terms of moving their school nurses in-house, and we wanted to give them full time to get that positively together, we have delayed the transfer and instead did a subtitle about strengthening, which requires DBH to produce a pretty comprehensive report this October looking at a variety of different things, staffing, retention, the budget model. Should this be contracted? Should we bring it in-house? Does every school need a DBH-funded clinician, given that a number of our public schools at this point have already hired their own social workers, school psychologists, et cetera? DBH hadn't done an environmental scan until this year, something we had been asking for, which is, I don't know, how many social workers do we have working across our DCPS and public charter schools? So, took heed to some of the concerns that folks were raising, but we felt like we needed a drastic shift. So we're gonna look for the report in October. We'll probably have a couple of follow-up hearings. If we don't see movement, I will recommend that we move it in FY '27.
Got it. Okay, thank you. That's really helpful. I know the tragedy on South Capitol Street predates me at the council. I think we might have been staffers at the time. But I hear your points then. All right, so that's helpful. So the goal with this is just put it real plain and clear to DBH what you, as the chair of this committee, need to see. And if they cannot meet this, then it's next year that you'd be prepared to make that transfer. Okay. I just note I had heard from some of my different school-based clinicians with some concern around that, but it was very hard to pin them down on exactly what they were concerned about. Was it drafted language or what? So you provided a lot of clarity on that. I'm happy to support and work with you on this so that you get what you were looking for at a DBH. It is an agency that I've been frustrated with many times of a lot of promises, but not a lot of delivery. So I hear you. That was my only question on that. So thank you very much. Appreciate it.
Thank you. Councilmember Felder?
Madam Chairperson, first and foremost, I just want to thank you and members of your team for all the hard work that has gone into this report. I just want to commend you on funding programs like the Farmer Market Support Amendment Act, the Grocery Access Pilot Program, Ward 7, and East of the River programs like this really does wonders for our community, especially as we continue to tackle our food desert. And I also want to just commend you on your investments surrounding opioid and tackling we know that overdose rates, specifically on Minnesota Avenue, is a key issue for the ward. So I just wanted to thank you for that.
Thank you, Councilmember Felder. And I would, on all of these various things, encourage, if someone wants to go deeper on some of these issues, to read the committee report. We do pull in information from what happened at performance oversight to what happened at our hearings and some of the meetings and ongoing. Our choices were not made by lack of information, but actually driven by some of the oversight work that we've done. But I'm going to now move the report and recommendations for the Committee on Health for fiscal year 2026 budget for agencies under its purview, with leave for staff to incorporate any technical changes made in consultation with the General Counsel or the Council Budget Office as appropriate. All in favor, please say aye. Aye.
Aye.
Great. The ayes have it, and the motion passes unanimously. Before we adjourn, let me recognize the work of those who helped my staff and I through this process. Errol Spence Sutherland, Ann Phelps, Jen Budoff, and Joe Wolf and their team at the Council Budget Office, Nicole Streeter and David Guo in the Office of General Counsel, making sure that we were always legal. Kevin Lang and Deborah Fries in the Office of Revenue Analysis. Thank you for not denying our phone calls and emails, even when you were on vacation. Thank you to Adrian Reed, Adriana Dean, and Darren Schaefer in the Office of the Chief Financial Officers. Our AFOs are rock stars who truly know where all the bodies are buried. I want to thank the agencies for engaging in the committee process with us during this both performance and budget. Beyond the hearings, the agencies have worked with committee staff to answer pre- and post-hearing questions and to provide us additional context, even on holidays, even on the weekends, especially last week. So thank you so much to that. I especially want to thank my staff, including my Chief of Staff, Mike Schaefer, Deputy Chief of Staff, Heather Edelman, Committee Director, Ona Bacchus, Legislative Director, Gabrielle Rogoff, Communications Director, Sierra Wallace, Constituent Services Director, Ana Barros Vasquez, Senior Policy Advisor, Marcia Huff, Health Policy Advisor, Rebecca Cooper, my Legislative Assistants, Ashley Strange, and Neka Ojawule Leger. I practice and I still messed it up. I'm so sorry, Nika. And our legislative aide, Taylor Coleman. There's no further business before the council. We are adjourned. It's 4:16 p.m. Thanks so much.